people do do TMS for ADHD. It's not, as I said, it's not covered by insurance unless you have a comorbidity that, would qualify you for coverage, which a lot of people probably do. But it is effective. It is effective in managing symptoms of ADHD. And if you have a child that is struggling with ADHD, I would encourage you to look into it, particularly if you're not happy with the medication, the way the dosage of medications is going, or if you're starting to have conversations about upping the dose or adding a second pill, maybe try this before you add a second pill.
Hello and welcome to The Positively Healthy Mom. I'm your host, Laura Ollinger, teen and young adult wellbeing coach, and I'm very excited to introduce you to my guest today. Kelly Jensen is with Brain Performance Technologies, and her journey began when she was exploring treatment options for her son with autism and found something that most people have never heard of, a non-invasive brain stimulation called Transcranial Magnetic Stimulation, otherwise known as TMS. So Kelly, welcome to the show.
Thank you for having me. It's a pleasure to be here.
Yes. Absolutely. So why don't you walk us through your story and tell us like a little bit more about how you got this treatment for your son?
Yes, thank you. So I have he's 26 now, but at the time when I first discovered TMS, he was 22. My son is severely autistic, but he also has OCD, obsessive compulsive disorder. I'm sure in your practice, you know that comorbidities run deep in some of these psychiatric conditions. His was OCD, and it ticked up and down throughout his life with the rigidity of autism and with anxieties. And he was 22, had aged out of the school system. I had sent him to a residential school in Massachusetts. Well, I'm in California, so it was in Massachusetts, so it was quite far. And he did great until about 6 months in, and then he just got too homesick. He had to come home, but that was conflicting for him. He wanted to come home, but he was also really sad to come home because it was the first bit of independence he had had. And, there's not a lot of opportunities for independence for a severely autistic person. So all of this anxiety and all of this rigidity was manifesting in obsessive compulsive disorder and particularly hoarding. He was developing a hoarding problem where he just could not leave the house without stuff. First, he needed books. Then he needed books and puzzles. Then he needed books, puzzles, toys. Then he needed books, puzzles, toys, pens. And then he needed books, toys, puzzles, pens, clothes. And it was getting worse and worse. And we were talking to go to this grocery store. And then he would get in the grocery store and he couldn't pick one or two things. He tried to fill up a cart, and he had a really bad meltdown in the grocery store one day over just not being able to choose three things. And I was desperate to help him. And he was on all of the classic medication cocktail that they give autistic people, and none of it was working. And I was very frustrated. So I said, forget about autism. What about OCD? What treatments are available for OCD? And I learned that transcranial magnetic stimulation, TMS, it's abbreviated to, is FDA cleared for OCD. And I said, well, what's that? I've never heard of that. Can autistic people do TMS? Of course they can. Is there any providers in my area that are familiar with autistic people? Because it's a magnetic pulse that's delivered to the scalp with a big magnet. And I thought, well, somebody's got to really know about an autistic person to be able to, keep him calm enough to do that. And I found out that there's a version of transcranial magnetic stimulation called MERT, magnetic e-resonance therapy. And it's really just a personalized version of TMS. And there was one provider in my area that was doing it, and I wanted him because I wanted somebody that understood autistic brain. And so that's what happened. I said, I'm trying this. We're doing this. It's the treatment. TMS is every day for 30 to 36 sessions. So you go 5 days a week for about 6 weeks, and each session lasts about 20 minutes. And we did it, and it was amazing. Got such relief from his OCD. And then he started talking more, which was not why we didn't. It was just a consequence. It was just, that was not really, I would have never done it for that at 22 years old, but it really was amazing to see him articulating himself more, to see him strive to find words and have them be accessible. I think maybe just because he was so much less anxious, right?
Right. That's what I was thinking. Yeah.
Yeah. So he was able to process language and then get the feedback and payback from language. So then language started becoming his go-to, and he wasn't concerned about syntax or grammar or how to say things correctly. He just wanted me to get his point across. He wanted me to know how he was feeling or what he needed. And it was awesome. So that was it. I was hooked. I said, I have to tell my mothers about this. We were talking before the podcast, and I was telling you I was incredibly upset that I had taken him to so many psychiatrists over the years, and none of them had ever told me about it. I don't ever want another mother not to know about this. Maybe it's
Mm,
not right for you, but it's another tool in the arsenal of intervention, and you should at least be told about it.
right. Right. Well, I'm so glad you're getting the word out. And it immediately, when it came to my inbox, the email from your team, just there was flashing lights around it because I agree. Like I personally have taken, like I mentioned earlier, a continuing education course from a psychiatrist and learned all about it. But I don't think the average person knows what it is, what it treats, how it works. So why don't you walk us through that? Because I know you're really great at putting this in like really simple language so that, the average person can understand.
I have, since being on this journey, I have listened to all of the psychiatrists and neuroscientists and neurologists that talk about this stuff every day. And I probably the best layman's explanation I heard a neurologist give was, think of your phone as your brain and think of the magnet as a phone charger. So it stimulates neurons in the brain the way your phone is being stimulated when it is, on the charging station. And it's really that simple in a layman's perspective. Now, I encourage everybody to geek out and go, read the science behind it. But it is
Hmm.
a known intervention. It is FDA cleared for depression, anxious depression, OCD, which is how I found it, smoking cessation, believe it or not, and migraines. The condition that enjoys the most insurance coverage is depression. Depression in those
Right.
ages 15 and up that have failed to make progress on other medications. But the other indications are FDA cleared. They're just harder to come by insurance because they have been branded not the standard of care, and they're not the standard of care because they're not prescribed. Not that they're not effective, they're just not prescribed. And even TMS itself is only prescribed by a very small amount of doctors and psychiatrists. And it's anybody's guess as to why. I would imagine just because they haven't heard of it, maybe. I don't know. But it
Mm,
is not an alternative medicine. It is sitting right in your health plan for those conditions, and it is used off label by people in the know all the time. In our clinic, we offer different protocols. So there's different ways that you can use the magnet. There's the traditional way, which is one specific pulse in one specific spot on the scalp. There is accelerated protocols, and there are personalized protocols. The one that I did for my son is a personalized protocol called MERT. And MERT just received FDA clearance for PTSD. So MERT for
oh.
PTSD is going to be the first new FDA cleared medical treatment for PTSD in over 25 years. And as of right now, well, no, it is now, but as of 2 months ago, the only two things cleared for PTSD were medications, two different SSRIs. So
Mm,
exciting time.
mm-hmm,
I have a paper all about it because I'm all about research, right?
mm-hmm.
And I'm happy to send this to you and share it with anybody that's listening to this podcast and might want more information. And I just sort of curated the information, the research, the timeline of FDA clearance and approval, and really kind of like a Bible of what TMS is for people who are interested and want to have the research available at their fingertips.
Mm-hmm. Okay. So basically, it's stimulating the underactive parts of the brain. Is that correct?
Sometimes the parts of the brain are underactive, sometimes they're overactive, and
Right.
so it is syncing up those areas of the brain that are not connecting, that are not in sync, that's why one of the main benefits of it is it helps reset circadian rhythms so you sleep better. So,
Mm, okay.
particularly in PTSD and particularly for autistic children that do the MERT treatment, they almost universally get better sleep. Sometimes autistic kids have a hard time sleeping, and their sleep is greatly improved by this because it's resetting
Mm,
circadian rhythms, and our brains work in patterns, right?
mm-hmm.
So neurons fire, brain waves fire, different types of brain waves that we use in different ways for different activities, for thinking, working, sleeping, all of those things. And through genetics, trauma, sometimes, concussion, even physical conditions, our brains get out of sync. And so TMS is a way to refire neurons and resync the connections in our brain that it needs to function at its best.
Okay. Okay. And can you explain? I'm just curious about the treatment protocol is pretty intense with, like you said, your son 5 days a week for 6 weeks.
Yeah.
Is that the case for everyone, or was that because that was just that specific MERT type treatment?
That's pretty much the case for everyone. Since my son has done
Okay.
treatment, the accelerated protocols are here, meaning that they have received FDA clearance. So there are people, because people do travel for it. We in our clinic people travel quite a bit because it's not available in all areas of the country. And so some of the manufacturers of the equipment were able to get clearance for doing multiple treatments a day. So rather than you can do anywhere from 2 to 10 treatments a day. I mean, in our clinic, 10 is very, very intense. The most intense is 10 treatments a day. It was actually pioneered at Stanford. It's called Saint. And it is for people who are struggling with acute depression, people who are having thoughts of suicide, people who are suicidal. So Saint, 10 treatments a day for 5 days. It is almost an in-person treatment because you're in a clinic all day doing the intense protocol.
Hmm.
But it works. It's very effective. So you can do with other accelerated protocols that have just received FDA clearance, you can do anywhere from 2 to 10. And so we do have a lot of children that we treat in our clinic, and we try to stick to two, 1 to 2 a day for them because they are pretty sensitive to the stimulation. But
Hmm.
it's great. So if you're doing 2 treatments a day, you would take the 30 session and you would condense it into probably 3 weeks, right? So half the time.
Okay. And so I know, again, this was originally designed for treating depression, but then since then they discovered that it helps these other conditions. The one I was most interested in is ADHD because a lot of clients that I get, that's kind of like you said, one of the kind of comorbidities, right? They have feelings of anxiety, they have some ADHD,
Yeah.
right? Like there's just kind of some multiple challenges. And so, can you tell us a little bit more about that?
So ADHD is one of the conditions that is not covered. It is used off label quite a bit because
Okay.
people who have ADHD are a lot of times given medications. And I don't know if your families have told you this, but they have a honeymoon period with the medications and then they lose efficacy and then they're layering medications, or a lot of times a comorbidity of depression will set in. So people do treatment, do TMS for ADHD. It's not, as I said, it's not covered by insurance unless you have a comorbidity that, would qualify you for coverage, which a lot of people probably do. But it is effective. It is effective in managing symptoms of ADHD. And if you have a child that is struggling with ADHD, I would encourage you to look into it, particularly if you're not happy with the medication, the way the dosage of medications is going, or if you're starting to have conversations about upping the dose or adding a second pill, maybe try this before you add a second pill.
Right, right. And that, a lot of times there are side effects with those medications, I would say more often than not. And so it's a nice to know that there is this other, treatment available. And so what kind of benefits are they seeing? You said it's kind of just reducing the symptoms. Is it really helping kids focus better? Is it helping with the H part, the hyperactivity part? Like, what does it most help?
Yeah, I would say, well, it resets circadian rhythms. So if you have a child that has ADHD that's kind of up all night, that is kind of crashing in the morning because they were up all night
Hmm.
because their circadian rhythms are all out of whack, it would definitely help with that. It definitely
Hmm.
helps calm the brain. It helps focus. It helps just maximize function of the brain.
Mm-hmm. And so when they are, I assume that because they are mapping the brain, right? When they kind of get you set up. And so how is it? I guess that's what I want to know. Can you walk us through how they make sure they're targeting the right areas and not the wrong areas, or making backwards progress, anything like that?
Sure. Well, you wouldn't make backwards progress. You might
Hmm.
not make as much progress on some of the protocols, but there's by and large, the chief complaint with people who have tried TMS is that it hasn't worked for them. Well, there's a difference between haven't worked to setting you back. So
Okay.
it's well tolerated, and some people get more benefit than others. But generally, the magnet is placed in standard TMS that enjoys the most insurance coverage. The magnet is placed on the forehead, and it penetrates about 2 inches deep to the spot of connectivity. They call it the golf ball. It's like a spot of connectivity, and it's pretty accurate. So everybody gets some relief. Now, some of the MERT is designed to add a second magnet placement in the back of the head, and that might It does often for many people, it increases the efficacy of the treatment. The SAINT protocol, some of the accelerated protocols add a layer of fMRIs or MRIs to them to get closer to this golf ball size spot of connectivity, but that's really what they're targeting. But standard TMS does a great job of that as well.
Okay.
Does your teenager tend to freak out when the new school year is about to start? Well, here's the good news. They don't have to. Sign your teen up for my free webinar called How to Start the School Year Without Freaking Out. We will tackle time management, the skills to handle the stress and pressure of school, social life, social media, and the brain-body connection behind stress and focus. Sign them up. The link is in my show notes. They're going to love it.
So when someone comes into your clinic and they're being treated for any of these conditions that we talked about, how does someone decide which one is right for them, I guess?
Well, the doctor. That's a conversation with the doctor. Listen to your doctor. In this, we go through all the different. In my booklet, we go through all the different options available to you. But yeah, ask a doctor about it, and why he feels that MERT would be right over TMS. What I want to tell everybody listening, and everybody should know, is do the one you can afford. So if you are really needing insurance coverage to make it work, then that's the treatment that's right for you, right? Because we don't ever want to do anything that is going to send us into the poorhouse. We don't ever want to do anything that is, out of pocket when there is an effective way to pay for it. So if what's available to you is standard TMS because you have been struggling with depression, or you have a teen that has been struggling with depression, then that's the best one.
Okay. All right. I guess kind of like there were so many options. I was like, whoa. But yes, I see what you're saying. It's kind of like through the doctor's care and then kind of that affordability factor. Okay.
Just as a mom of an autistic person, autism is one of these things where you're off label and without coverage the day you get that diagnosis, because nothing that you want to try for autism is ever covered by insurance. So that's just a standard thing I tell parents that are looking for options for their autistic children. Start with what's covered. Start with what the insurance companies pay for. They pay for certain therapies and they pay for certain, most of it's therapy that you get through an insurance carrier or through your school district services, through your school district. Start there. And then when you start evaluating what you can afford off label, then, you kind of rank it as to, from most evidence to least evidence, and then you go that route. So I always apply that logic to everybody. Start with what you can afford.
Yes. Okay, so what else do you want to share with the moms today? Because I know you're so passionate about this and how much it helped you and help your son. I'm sure there's more that you've got to share.
Well, I thank you. I appreciate that. More than anything, I just want moms to know that there is a drug-free alternative for children who are struggling. That is what I was upset that nobody told me about. No mom wants to medicate her child, and we do it when we have to. But if there's a doctor out there that is not telling you that there are other things, then put his feet to the fire and say, why not? Why shouldn't I try this? I've read about this. I've studied this. So TMS is one of those things I want everybody to know about so that they can make informed choices. In opening the clinic and starting this treatment center, I have met so many moms, and I have a dear friend who is the mother of an autistic young adult herself, and her and I have been friends for decades, right? In our journey to parent autistic children, and she's an editor by trade, so she was in my office one day, and we were going through the website. She was helping me edit it, and a mom came in, and she had a daughter that had gone off to college and was unable to be at college. She had a breakdown in college and got her home. A late diagnosis of autism followed, and the daughter was in the clinic doing treatment, and the mom wanted to introduce herself, and she just fell apart. She just started to cry, and she was racked with guilt, and how could I have missed this? And she was always bright, but there were things I should have known it. So we sat with her for a while, and we gave her kind of the Autism 101 ropes, and kind of tried to talk her off that guilt ledge, because nobody deserves to be on that ledge. And when she left, we decided we needed to do something, and the Refrigerator Moms was born. The Refrigerator Mom stems from the Refrigerator Mother theory that was prevalent around the time when autism diagnoses were first coming into the lexicon, and the autism community said that if your child was autistic, it was your fault as a mother. You were cold.
Whoa.
You were a refrigerator mom, and you needed to hug your child and show your child more affection. And if you didn't see improvement, they were going to take your child away and institutionalize your child.
Oh, man.
It was horrible and awful, of course, and untrue, of course, because here there
Mhm.
were women going to see doctors to get help for their children and wondering why they weren't talking, and they were told it was their fault. And so we decided to name ourselves Refrigerator Moms, and as a cheeky nod to them, and to reclaim the name as an advocacy, not for guilt purposes. And so
Mhm.
we have a podcast that we're called the Refrigerator Moms, and you can find us on all of the social media outlets, and we write papers about all topics, parenting neurodivergence, and they're free to use as a jumping off point for whatever you're struggling with as a parent of an autistic or neurodivergent person.
Yes, I love it when there's some great resources out there. And so multiple times I've heard you say children, and I'm wondering, what is the youngest age that you treat?
So the treatment is safe to do for children from ages 3. We say
Mm.
3 to 99 because some people do it if they've had for stroke recovery. It's not covered by insurance, but it is known to be effective for stroke recovery or the early stages of dementia, not Alzheimer's, but dementia in the most early stages. And some people just, if they can afford it, do it because they know they have a history of those conditions. And so we say 3 to 99. And little kids, the brains are placid. They don't have any negative coping mechanisms that have developed yet, so they tend to do very, very well.
Yeah, that's what I was thinking. I'm like, those brains in a young age it sounds like it would be amazing. And then how do you explain it to kids? Because yes, it does sound scary to have like being hooked up to something in a magnet. Like it sounds like it's like scary. So how do you help kids and moms feel more calm about the treatment?
That's a great question. I don't think anybody's ever asked me that. Oh, I mean, certainly moms have, but great question. So a couple things. So I'm sure you're familiar with social stories that we write for people who are not quite verbal yet, that help explain scary things. And there's,
Mm.
a speech therapy designation for writing social stories to explain things. So in our clinic, we have a stock social story for treatments, and we give those to parents to share with therapists, and to, they're able to personalize them for their own clinic and their own treatment. And we take it slow. Sometimes kids go through those social stories for 6 months before they do treatment. They do a little tour of the facility. They, feel the magnet on their forearm so they can kind of get used to that. They check out the snacks. Sometimes we get a list of their preferred snacks, and we just make it really kind of fun for them. And like
Mm.
going to the dentist, right? You have to kind of prep
Mhm.
your kid for going to the dentist. There's the box of toys, there's all of those things. And I would say the social story prep is probably the biggest thing that we advocate for and help with. And sometimes we have them bring in dolls. Sometimes we have them, mimic treatment on mom or dad. Things like that. Just getting them,
Mm.
curious about it. And the biggest thing is that it doesn't really hurt them. So usually I would say 99% of the children settle in about somewhere between 5 and 10 treatments in. And then you'd swear
Okay.
they like it. You'd swear that they love the feeling of the magnet on their forehead, kind of a thing, right? I think.
Yeah. So what does it feel like?
It feels like a little tapping on your forehead. With the younger children, we tend to go a lot slower because they're very sensitive to the stimulation. So it
Mhm.
really just feels like a tapping on the forehead, and the weight of the magnet. When my son was young, a occupational therapist taught me how to do head compressions on him.
Mm.
When he would get hyper or he'd have a hard time controlling himself, I would do these compressions, on his forehead and his scalp, and and his jaw. Kind of, there was a little exercise they taught me to do, and I swear it mimics that. That's the only thing I can think of,
Mm.
like, just kind of the weight of the magnet on a little light tapping, and it's like kind of a 5-second pulse, and you take a break for a few seconds, and the neurotechs sing songs during the break, or they put a TV show on, or they do funny faces, and kids end up enjoying it.
Yeah, okay. So if there is a mom listening who, and I'm sure there are many who are kind of interested in, what would you encourage them to do as their next step?
I would encourage them to follow my social media, Brain Performance Technologies, or Refrigerator Moms. We talk about it a lot on Refrigerator Moms. I would encourage them to ask their doctors about it, but go armed with information. Don't, because sometimes if you go, they'll just say, no, I don't think it's a good idea. But if you say, well, I've read this, this, and this, I want to try this, then there might be more apt to listen to what you have to say. I know in Texas where you are, there are several MERT clinics, several colleagues of Brain Performance Technologies, and they're excellent. They do an excellent job. So just talk to the clinics. And then I have a Facebook group. It's called MERT for Autism USA.
Okay.
For PTSD, you can get more information there. Parents share experiences all the time on that. And then the last thing I would say to parents are like, oh, this is too expensive. I agree with all that. If it's something, again, never do what you can't afford. So that's always the number one leading advice. I would say keep it on your radar. And the second the doctors start prescribing medications, start taking copious notes of the effects of those medications. And the argument that, well, my child is being given an SSRI or a mood stabilizer, perhaps a diagnosis of depression is appropriate. Why are we giving for his mood? Maybe there is depression, because a lot of times people will think that if you're a nonverbal autistic, you don't have depression, you just have autism. Well, if you're being medicated as if you're depressed, maybe you're depressed, and it's a misnomer that you can't, verify that there's a little bit of depression going on. You have to work with a therapist. It might take you a little longer to analyze that diagnosis, but keep it on your radar, because then maybe at 15, they will be eligible through their insurance plan if you've tried medications and you haven't made much progress. Have a diagnosis of depression.
Okay. That's some great advice.
Or OCD, right? Maybe you have, OCD and nothing else has worked. And so OCD is generally covered by insurance through single case agreements. So, you might do it that way, but keep it on your radar, even if it's something that you don't try right away.
Okay. Well, Kelly, thank you so much for sharing your time and knowledge, and I guess I feel lifted up and motivated, because to know that there's help out there for people who may have been desperate for help and didn't know what else to do and didn't know what else to try. And now here's a new tool in their toolbox. And hopefully I can assure you that there will be somebody who takes the next steps that you're talking about, because now they have this information. So thank you.
Awesome. And not just for your kids, for yourself. Maybe it's something that you struggled with. Maybe you have been taking medication and, you haven't got much relief. Or as we age, the side effects get a little bit trickier with medication, right?
Yeah.
I did not have a depression diagnosis, but I did it to help my symptoms of menopause, because I was really struggling with some of those. It gave me great relief. So.
Wow. Okay. Sounds great. I love that. Love some more symptom relief. So, okay. Well, Kelly, thank you again. I appreciate your time.
Thank you so much for having me.
When you get a chance, please go to the show notes and click on the link ratethispodcast.com/TPHmom to give my podcast a rating and review. And if this episode resonates with you, be sure to share it with your mom friends who are going through the same things. Be sure to tune in for next week's conversation. Until then, keep up the good work.